Good afternoon. As a medical doctor, I certainly understand how this coronavirus can impact our community. We are all working together to try and minimize the impact as much as possible. The county's role in this crisis is to prepare, to educate, and to respond. That's what we have been doing up until today, and that's what we are continuing through this process. Today, I issued an executive order declaring a state of emergency in St. Louis County. My order is designed to give our public health team the tools they need to fight the spread of this virus with all the resources of county government. In other places, community transmission has occurred soon after the identification of a travel-related COVID-19 infection. Although we don't have any community spread cases yet diagnosed by a test in our community, we believe that it is highly likely that COVID-19 is being transmitted in our community. The symptoms are mild, and testing has been limited because of the limit of national tests. As of 5 p.m. today, my executive order requests that there will be no gatherings greater than 250 people in any one room or enclosed space. This does not mean 250 people in one building. This is an enclosed space. We are doing this because of CDC guidelines, and they recommend for minimal to moderate presence of community transfer in a community that we limit gatherings to 250 or less. If individuals are elderly or have chronic medical problems, we would advise them to avoid crowds altogether and to employ social distancing techniques. That means 3 to 6 foot away from individuals and contact for less than 15 or 20 minutes. In that setting, the likelihood of transmitting COVID-19 among individuals is extraordinarily low in the absence of coughing or sneezing. We hope that everyone will exercise common sense and goodwill to our community and avoid large gatherings. This is not a decision that I took lightly. I consulted with experts, I consulted with regional leaders, and I prayed about it. I believe this is the right decision. It is the kind of serious and responsible measure that our community needs at this time. In addition to limiting contact, we encourage all of our residents to take all the measures they can to stay well. We again ask everyone, wash your hands with soap and water. If soap and water is not available, use a hand sanitizer. Cover your mouth when you cough or sneeze. Avoid close contact with others, especially those who are sick. And if you are sick, stay home. I know that staying home is not easy for everyone, especially those who don't have a home to go to. Last night, I directed our Director of Human Services to work with our emergency management team to find ways to help unhoused and others living in poverty. Missing work often means taking unpaid time off and getting behind on bills. Today, I am recommending that the Civil Service Commission adopt new, more flexible temporary leave policies for county employees. The new policy allows employees to expand sick leave, vacation leave, paid time off, and comp time for any COVID-19 absence. No family or medical leave paperwork will be required. And St. Louis County will allow employees affected by the coronavirus who have exhausted all of their accrued leave to borrow time against future accruals. If we are asking people to stay home, we must work to ensure that they can stay home. Yesterday, Missouri American Water announced it was placing a moratorium on service shutoffs and restoring service to customers who had been shut off. My staff has contacted Ameren and Spire and encouraged them to provide relief to their customers. I hope each will announce a plan as soon as it is possible. We don't want anyone who is quarantined to be forced to leave their house. I would also ask that landlords and banks suspend any eviction or foreclosure procedures. And later today, I expect the courts to announce changes as well. Thanks to each of you for the work that you're doing for the county. We will get through this together. Most individuals who contract the COVID-19 virus, 80%, will move through this with mild symptoms. Others will be more affected, and we need to take these measures to protect everyone we can.